Len Bruce, Executive Director of Medical Services, Murrumbidgee Local Health District. It was a bit funny, I had to explain to the junior medical officers what that actually means. So, at least I'm not acting anymore. So welcome everyone to the first media briefing of 2021 in regards to the COVID-19 pandemic in the Murrumbidgee Local Health District. Firstly, happy 2021 to everyone in the community. And it's always nice when I can start with a media conference with all good news. So the first thing is that there were no new cases in the last 24 hours, so we're still at 58 cases, and sadly the one patient who passed away. But the community has been absolutely magnificent. We're nearing our 100,000 tests, and this week we should also probably get to about 80,000 people that we've tested, which is essentially 1 in every 3 people in the Murrumbidgee Local Health District have had a COVID test, and some like me have had more than one. The downside of hay fever, and you're worried, so I think it's important that we keep on doing what we're doing. I think the QR codes are working brilliantly in the community. You know, it really does make things so much easier if we have that information available in an electronic form. Obviously, the great news for us is that Australia is going to roll out a vaccine in the middle of February, which is about 4 weeks away, which is really great news. I think when we started talking about this 12 months ago, that was really what we were all aiming for. And I'm lucky enough to hang Frank Evola here, and he's going to come and have a chat to you. He's the Murrumbidgee Local Health District COVID-19 Vaccine Program Coordinator, and he's been involved with COVID since the inception, and he's been, you know, busy with everything from fit testing of masks to training of staff. So I'll get Frank to come over and give you an update on where we're up to, and then we'll both be available for any questions which you may have. Frank.
Good morning, I'm Frank Evola, Staff Health Clinical Nurse Consultant for Murrumbidgee Local Health District, and now I'm heading our vaccination implementation program for the health district as well. So we, within MLHD, are following the Commonwealth and Ministry of Health recommendations and guidelines with regards to the implementation of the vaccination. The Commonwealth and Ministry are spearheading this, and they're doing a fantastic job of guiding the LHDs into this implementation. So we'll be following all recommendations that come out of that. With regards to vaccinations, though, at the end of the day, this is still delivery of a vaccine. That's one of our core businesses within healthcare, so we're very well positioned to be able to deliver a vaccine, even a new one like this. There's obviously specific intricacies that come with delivering a vaccination that's new to development. But we have robust systems in place, both within MLHD and at a state and Commonwealth level in regards to being able to monitor vaccine safety, adverse events following vaccinations, and with the COVID vaccination being new and an unknown entity, we will be actively and aggressively monitoring for adverse events, specifically anaphylaxis. We are at a luxury of the fact that Australia, with the low level of circulating COVID-19, that we can take a kind of a staged and cautious approach to delivery of the vaccination. The rest of the world has already started delivering the vaccine, so we can follow in their footsteps and learn from any issues that have arisen from the COVID-19 vaccination. So we're positioned very well in that respect.
Are you right to take questions on that
Absolutely.
now, or do you want to come back, Len, or anything?
No, I think we're happy to take questions. And
so, Frank, just on that, you know, there'll be some people concerned with what they've seen in recent days, just with some of the reported adverse effects of the vaccine. Is there any reason for people to be nervous? You know, how is Australia sort of responding to some of those issues that have cropped up?
Yeah, I mean, vaccination overall is very safe. There's very low rates of adverse events, anaphylaxis, and up to and including death. Even with the COVID vaccine, there's been increased reports of some adverse events in Norway recently. However, globally speaking, there's been it's a higher rate of anaphylaxis, but it's very well managed anaphylaxis. And that's, within the context of vaccination, it's something that our nurse immunizers, both within MLHD and across New South Wales Health, are very well trained in the management of anaphylaxis as well as the recognition of it. So it's something that we know how to handle and can handle very well. And with the anaphylaxis experiences overseas, it's been early recognition and proper management has been the key to success, and it's something that we can easily manage here.
Should people still be getting COVID tests after they've had the vaccination if they have a sniffle or a cough or something like that?
Absolutely. The Pfizer vaccine seems to be far more effective than, or I shouldn't say far more, it seems to be more effective than the AstraZeneca vaccine. However, there are individual intricacies, so you're better safe than sorry, essentially.
I spoke to a local nurse last week that was concerned that the rollout could be a logistical nightmare. Are you certain that the Commonwealth is going to provide you with enough fridges for these vaccines to be held in?
Absolutely. So when you're talking about vaccine delivery to an entire population, 25 million within Australia, there are challenges associated with that. However, we have robust internal networks. We deliver vaccines, medications throughout the district to all the hospitals on a regular basis. The Commonwealth and the Ministry of Health are taking a cautious approach with the rollout of this vaccine, given some of the nuances of the vaccine itself. We want to make sure that the vaccine we have is able to be delivered to the population, so we don't want to lose vaccine due to mishandling. So with that in mind, it's going to be a staged rollout to make sure that we understand fully how to manage this vaccine, because it is a new type of vaccine, so we don't want to, essentially we don't want to stuff it up.
Are there any people groups who won't be included, who won't have to get the vaccine, that they don't need any, like they're not required to, basically?
For the purposes of healthcare staff, it's not a mandatory vaccine. But we're going to make it available to every staff member. So if you want it, you'll get it. And there's more than enough doses purchased by the Commonwealth to facilitate everyone that wants a vaccine to have it.
And just on the logistics as well, how does someone go about getting it? Is it a GP thing, or do you have to go to a COVID clinic?
A lot of that's still being developed. The fine points of delivery of the vaccine. So even within MLHD, we're still working that out. But we have a bit of time to figure that out. But we have adequate numbers of nurse immunizers. If it goes down to GPs, there's plenty of GP clinics, so we can reach our community. It's just figuring out the finer points of how we do that.
Will you be favouring the AstraZeneca vaccine because of the refrigeration necessities of the Pfizer vaccine?
So the AstraZeneca is an easier vaccine to manage from a cold chain perspective, because it fits within the requirements that we deal with on a normal basis for vaccinations. The Pfizer is a little bit more complicated because it requires a cold storage. However, there is the capability to thaw it out, and then it falls within that 2 to 8 degree cold storage for a period of time. Because it's a relatively unstable vaccine, until we fully understand in an Australia context, particularly regionally, we'd be delivering this vaccine in summer. Until we understand how it responds to our conditions, we just want to make sure we're handling it as cautiously as possible.
difference does the new strains make, Frank? Does it impact the efficacy of the vaccines that we've got now?
So there's recently, the Pfizer vaccine was challenged against the UK strain relatively recently, and there was promising results out of the efficacy of the vaccine against the UK strain. It all comes down to the dynamics of the mutations in in where those mutations sit in response to what the vaccine's targeting. But to date, it's very promising that the vaccine can manage most strains.
I'm not sure who would be best to answer this question, but if the vaccine does appear to be effective and majority of the population have agreed to have it, how quickly could we start to see restrictions easing in the community or going back to normal?
Yeah, thank you.
So I think we need to look at the aim of vaccination. So, and the best way to explain it to people, it's like influenza vaccine every year. The reason why we vaccinate people against influenza is to prevent severe illness, hospitalization and death. So all the studies that have been done so far have proven that all the vaccines that are available are really effective in preventing people from getting severely unwell, going to hospital and dying from the virus. Currently, there is no evidence to prove that having a vaccine will prevent you from transmitting the virus to someone else. And I think that's really, really important. So that's why even if you've had a vaccine and you become symptomatic, we actually would be really keen for you to go and have a COVID test done so that we know, even though you may not become that unwell, and we see it with influenza every year. So I think that's really important. The other thing to remember is that the Commonwealth will ensure that people in Australia gets the most appropriate vaccine for people in Australia. And you will know that the AstraZeneca group will be publishing some more results soon in terms of their newest data, and that will help us to make a decision about what is appropriate. So it really is important that people have confidence that the TGA, the federal government, will ensure that we get the most appropriate vaccine.
In the UK, they're extending the amount of time between the two doses. What amount of time are you guys going to leave between the two doses?
So we would leave that up to the TGA. There'd be a recommendation. And the reason why in the UK, because they started with the Pfizer vaccine, was that in terms of the efficacy, you can probably get about 80% with one dose. And I think it really is just to make sure that everybody gets at least one dose before you get a second dose. But that is something that we'll leave to the TGA.
Is it likely that this might become an annual vaccine like the flu?
Very difficult to say. It may, but we don't know at the moment, because remember, we don't really know how long the vaccine will protect you for, because people have only been doing it for the last 3 months. There are exciting developments in vaccine where there are vaccines that you only need a single dose, and we waiting with bated breath for that group to publish their results. But sadly, no one has got long-term data at the moment, so it may end up an annual vaccine. But the great news is that the vaccines are doing what we're wanting it to do.
So it's probably a repeat of your information, but you're rolling out the vaccine here locally. When is it coming and who's getting it first?
So Murrumbidgee will have a distribution hub, and essentially the vaccine's divided in 2 programs. So the one would be for health staff, and that is managed by Frank and his team to make sure that healthcare workers receive the most appropriate vaccine as is determined by the TGA. The rest of the vaccine rollout will be managed by the Commonwealth, and they will provide updated information. But our plan is to commence in the middle of February, which is 4 weeks away. But the community can rest assured, we vaccinate people against influenza every year. The Pfizer vaccine is a little bit different in terms of storage, but in the end, it is just another vaccine. I think it's also important that vaccines are not the only things that cause anaphylaxis. It's probably one of the rarest causes of anaphylaxis. The commonest cause that it's in hospital is probably related to antibiotics, and we administer antibiotics to patients all the time. What is good is for us to know that people are at risk and how long we need to monitor them for. But managing anaphylaxis is something we do, and our staff are well trained, so people should not be concerned and not get vaccinated because they're worried about the risk of anaphylaxis. There would be appropriate screening done, etc., because depending if you're allergic to one of the components of the vaccine, and that's why, you know, it's a staged, organized process. But Australia is in a great position. You know, we're not in the same position as Europe or the US. We have time to have a staged rollout.
And just on something a bit different, I think the Victorian government has just made Wagga a part of the green zone. Is that something of a relief to you guys in terms of staffing?
I can tell you from a medical workforce point of view, us being part of the bubble is absolutely amazing. But I think that's a pragmatic and realistic approach. You know, the incidence of COVID in rural and regional New South Wales is very, very low, the same for Victoria. So it wouldn't make sense to follow the same restrictions, as you would in areas where the risk of community transmission is high. But that has made things a lot easier, and it just makes it more convenient for people who travel for medical care, especially.
Has the vaccine been developed, I guess, quite quickly, simply because it is almost relative to the flu vaccine, and you guys just had to tweak a few different things? Is that your understanding of it? It's not necessarily a new invention, it's actually a modification of current ones?
No, well, so the mRNA vaccines that we have, so which is the Pfizer is obviously the first commercially available example, is a novel vaccine. We've not had an mRNA vaccine before. I think the reason why it was developed so quickly is that it was a truly international collaboration. And because technology has improved from the emergence of the virus until the genetic code was mapped was really very, very quickly. And then the one process that was slightly different this time is that the phase trials were run in parallel. So you may have a phase 1 and 2 trial combined, or 2 and 3 combined, while in the past you would have 1 and then 2 and then 3 sequentially. So I think that has made a difference. And I had a look, there was about 200 vaccine candidates at last counting that people are looking at. So, it's a lot of work for the TGA and the regulators to do.
Are you concerned that the intricacies of the program are still being ironed out by the Commonwealth?
We vaccinate people all the time, so I'm not concerned. I think the reassuring fact is that they brought it forward by about a month. So clearly they're confident that they can manage it quite easily. And Australia's got a strong public health and primary care service, so it will be quite easy. And we vaccinate people all the time, so I'm in no way concerned. The fridges are a little bit different, but it's not a question that once you take it out of the -70, you have to use it within 30 minutes. It really is just the long-term storage. But there is no facility in the Murrumbidgee that cannot be reached with a 2 to 8 degree fridge, so I'm not concerned that we'll do that. And I do believe that we will utilize more than one, probably more than 2 vaccines, depending on what becomes available. But the benefit of the AstraZeneca vaccine is going to be produced in Australia, which means that we'll have essentially an unlimited supply. No, we're very excited and we look forward to the results. And the benefit is obviously it will be very well tested in the UK. And if people are worried about the UK strain, well, what better place to test the vaccine than in the UK?
If I can just add to that one too.
Sure, Clive.
Yes. With regards to novel vaccination programs, it's not unprecedented. If there's when the varicella vaccine was developed, it did go out to private purchase. However, once vaccines get implemented into the national immunization program, they roll out through school vaccination programs. So we do have the capability to flex up and be able to mass distribute vaccinations. Within MLHD, we've had done mass immunization influenza programs through Wagga Base Hospital, where we were able to deliver vaccine to about 1,000 people in one day. We've had the Bunnings Mass Vaccination Clinic. So vaccination is, from a clinic perspective, is very easily managed. And we have a strong network of specially trained nurses that are accredited nurse immunizers. And part of that training is understanding the delivery of vaccinations, the running of vaccination clinics, and specific training in the recognition of anaphylaxis and the management of anaphylaxis. So for us, I'm more than confident that once we're told when we're getting the vaccine, we can ramp up those networks quite quickly.
Abby?
Abby? Cool.
Yeah.
Thanks very much.
Thank you.
Thank you, guys.